Hello everyone, welcome back to this channel. Today I would like us to talk about determinants of health, and by determinants I mean those compelling or convincing or irrefutable factors that tell us whether somebody has a good health or not. And what do we mean by health? Health is a complete state of physical, mental and social well-being, and not merely an absence of disease or infirmity. And this is a definition by the WHO. So normally people consider the sickness, its absence or presence, to determine whether they are healthy or not. But according to WHO, we should also consider the other aspects, that the physical, the mental, and the social well-being. So if you are not sick, for instance, but you are lonely, you don't have friends, you cannot socialize, then you are sick, obviously. You are not healthy. So we should consider all the other aspects when we are talking about health. So we are going to look at these determinants of health, and I would like to urge you to subscribe, share, and give your comments. Thank everyone of you who have found time to watch the videos that I've posted so far, and also to those who have subscribed. I don't take this for granted. I thank you very much. So what determines health? One is the social status as well as the income of an individual. It is believed that higher income and social status are linked to better health, because these individuals are able to afford health. When they are sick, they are able to afford the healthcare services. Even these are the people who are registered in health clubs. They are able to attend regular health checkups at whatever cost. So these are the individuals, when they are sick, they seek for specialized treatments abroad, even if the same services are accessible locally within their countries. Number two is education. Those who have low education levels are linked with poor health, simply because these people have low awareness about their health, and even their health-seeking behavior is poor. You can look at health-seeking behavior presentation in my previous videos to determine whether you have a good health-seeking behavior or not. So those who are educated are believed to be aware of what is expected of them in order to maintain their health status. Number three is physical environment, and by physical environment I'm referring to the air that we breathe, the air around us, the water, the workplaces, the houses that we live in, the communities around us, and even the infrastructure. So if we are able to access safe water, the air around us is not contaminated or polluted, and the working environment that we are is healthy. The houses we live in are good enough. They are well ventilated, spacious. The communities around us are not hostile. There are no thieves around, no robberies. There is safety within the environment. Then the infrastructure, the roads network is okay. Communication systems are okay. Then we'll have better health. Number four is employment and working condition. If you are employed, at least they will be earning something to keep you going, as opposed to somebody who is not. And if the working conditions are also favorable, then such individuals will be healthy, as opposed to somebody who has no income, and even those who have unhealthy working conditions. And by employment, I'm also considering those who are self-employed, those who are doing their businesses to earn something. So these are the kind of people who are believed to have better health than those who have no income at all. Then social support networks. Greater support from families, from friends, from communities that we live in, and even from colleagues at work are linked with better health. If you have a support system, somebody, for instance, at workplace, where if you are not feeling well, your colleagues are able to tell you or to support you to seek for health care, then you will be having better health, as opposed to a situation where you have friends around you who, when you tell them that you are sick, they are telling you to man up. They are telling you you are a man, so just persevere. This is something that will go away. So these are the kind of people that will be contributing to your deteriorating health condition. Maybe they've seen you stressed somewhere. You are not socializing anymore. They are not even trying to find out what is going on with you. So with that, you don't have a support system, so you are likely to have a poor health. Then genetics, there are conditions that are linked to the genes. For instance, if your parents have certain conditions that are inherited, then chances are that you can also inherit the same. Then personal behavior and coping skills is also another determinant. This refers now to the lifestyle. There are people who live very risky lifestyles. The I don't care attitude. If it is food, they are eating junk foods. If it is exercising, they are not exercising. They are living sedentary lives. They are smoking. They are taking illicit brews. They are not able to manage the stress or any challenges that come their way. But if you are able to cope with this, you are able to eat a balanced diet. You are keeping active. You are exercising. You are not smoking. You are not drinking these illicit brews. Then you will have better health. Gender is also another factor. There are conditions that are linked to gender, maybe due to the anatomical differences or even the physiological. And by physiological, we are also considering the hormones, whether the amount or the differences in hormones that the genders have. So there are conditions that are specifically for men, and at the same time there are conditions that are specifically affecting the female gender. Then there's culture. There are cultural beliefs that affect health. Maybe there are certain communities that don't believe in going to a hospital when they are sick, or they don't believe in the modern medicine. They believe in the traditional medicine. So these are the kind of people that you cannot take any health advice from a healthcare provider. They believe in what their culture professes. Then health services is also another factor. So access and use of these services that prevent and treat diseases can lead to better health. So when we are talking of access here, we mean the geographical access, the financial access, even the linguistic. So some people might delay to seek healthcare services because of those forms of access. Maybe the healthcare facilities are far away from them, and the physical terrains are not favorable for them to access the services as soon as they need them. And in financial access, we are talking about the money that is involved, the payment that is involved in getting the services. If you are not able to afford the services, then you will not access them. Then we are also talking about the language, the linguistic. So if the people in the healthcare facilities are communicating a language that the patient is not understanding, then there will be no communication, and therefore accessing these services cannot be easy for them. So with that, we come to the end of these determinants. I saw it necessary to discuss with you. So now I think you are aware of what determines our health, and we can improve on this so that we remain healthy and even have a healthy society. So with that, I say thank you, and let's meet in my next video.